Hi, welcome to Accelerate Podcast. Today I'm joined with Emma Meehan from KinetikIQ. So, Emma, you come from a computer science, not a physio or an S&C practitioner background. How have you built credibility with practitioners when you've spent decades honing that clinical intuition?
Hi, Nicola. Thank you so much for having me on. This is such a profound and fundamental question, which it's oftentimes not very clear in the venture capital and startup world, because traditionally startups in health tech, in sports tech, it is that deep research and university backing that generally you see companies come from. So we've kind of inverted the model and come at it more unconventionally. So obviously, when you're rolling out any new product or service to clinicians, it has to be proven to be valid, reliable, accurate, and dependable for practitioners to work with their patients on. So that was always the first major hurdle for us for getting this product out to market. And so, how we've overcome this is we've been partnering with universities across Ireland to run through smaller validation studies, building up to a much bigger project. So, anything from goniometry comparison, motion capture labs, existing hardware systems for, force, jump measurements, etc. We have to validate against all of those to really build up that credibility. And frankly, it does take time. I'm 4 years full time on the business now, and we only launched in market last year, just down to those clinical needs, which, I'm sure you would agree are absolutely essential because you can't be selling snake oil to people who are dealing with people's health.
Yeah, I think there's a couple of things to kind of pull out from there. And we'll talk about your background as a competitive weightlifter and how having that athlete lens puts a different spin on things. But you've alluded to the ecosystems that you've developed the product in Ireland. And I think it just makes sense for us to pull that out now in the conversation. Like I wasn't really aware of how strong that ecosystem is until I've started to kind of investigate it more. What role has that played for you and the business that you're building?
It's fascinating. I think Ireland is very much an anomaly in this space because we go to conferences very regularly in the US. And if there are maybe 30 vendors there, often five of us are Irish companies that have come all the way over. Some of my peers like Output Sports, Arco, Stat Sports, Danu, Sports Impact Technologies, we're all really honing out our own sections of the market. And I think there are a few things that attributes to. Firstly, we're a very sports obsessed nation. Like whether that's our own native Gaelic games, soccer, rugby, Olympic sports, we're great at rowing, we're great at boxing. And so there's that natural love of sports, along with world class sports science and technology expertise as well. Because right now we're the last English speaking country left in the EU, and so as a result, we get a lot of wonderful engineers coming from overseas that want to start a life in Europe. And so
Mhm.
between that and our multinational companies that have been here the last 20 years, your Facebooks, your Googles, Apple, that has created a real tech ecosystem in Ireland that we've been able to grow out of. My background is working with big tech companies, and that was then before I was able to leverage Enterprise Ireland. So Enterprise Ireland, they have to be given every credit because there is no way I would have been able to build and launch my business without those government initiatives. I came from my previous career in software engineering, just knowing how to code. I didn't know how to write a business plan, develop a financial model, how to talk to investors. And so they were able to give me that first stepping stone, which is right. If you have an idea for a business, you can get 6 months where you have free reign to try out the market, build out your first iteration of your product, and see can you get a viable business. And they offer €2,500 in a tax-free stipend for those 6 months. So
Okay.
it's a real safe space to say, right, I'm going to just give this socks and see how it goes. And then they have follow-up funding. They open access to other markets. So I don't really think there's a parallel in Europe, or I don't know about anywhere else in the world that has this kind of government incentive because I believe that by number, they are one of the largest venture capital funds in Europe by deal flow.
Yeah, that's what I've read. And per capita of person, like the amount of startups, like it's pretty. And as I say, I I suppose I've been interested in this space for quite a while, but it is only when I started writing. I relaunched the newsletter that I write and started writing about companies that Oracle came on my radar, yourself came on my radar, Output Sports I became more interested in. And I was like, wow, there is a real common denominator here of Ireland. So, yeah, it's really fascinating. Um, you alluded there around, I suppose, the business. You're and the fact that you have this software background, but through the support of Enterprise Ireland and growing the business, you've learned around the business side. You're wearing dual hats there. You've got the CEO, you've got the CTO hat. How do you marry that together? And at what point do you think they may need to separate out?
Oh my goodness, I would say it's more closer to 10 hats than two hats. I mean, I have definitely started getting better at delegating because I have managed to attract an amazing team around me. So, I mean, initially, like I was a one-woman band starting off. So I was trying to cover tech development, marketing, financial modeling, which is, fundraising, and trying to manage like Excel spreadsheets, which I can tell you are not my favorite thing in the world. Even thinking about legal, compliance, hiring, like all this stuff was just completely bewildering. But thankfully, now we're at the stage with 8 full-time and 5 part-time staff that I do need to get out of a mindset that I would say is just one of my default personality types is that I'm a doer. I generally find it hard to delegate. It's like, okay, I'll be able to get it done. It's fine. I won't bother them. But trying to get my head around, well, no, if I'm not bothering someone, if they are working with us, believe in the business and wanted to move forward, and I'm only putting myself in the way of the company succeeding. So I've really been teeing up like this leadership team around me now. I mean, our head of software, Felipe, has been extraordinary, and our founding engineer, Harry. So I've been offloading a lot of that technical weight. So anything from, recruiting and hiring interns, just like managing laptops day to day, standard IT stuff, and planning out the whole product roadmap and backlog because every 2 weeks, we review what new features, are there any bugs in the system? How do we improve the user experience? That's a lot of meetings and work that goes into preparing for, right, what are the things that the dev team needs to get done this week? And thankfully now I've been able to bring Felipe and Harry to be able to own most of that. And so really when it comes to, right, what's the CTO ownership? At this stage, it's very much just budget allocation for the technical department and overall oversight on hiring and firing. But I do plan on fully relinquishing the title sooner rather than later because I'm probably just holding on to it too much like a baby at this stage, thinking about, oh, yeah, well, I was a coder, but I haven't contributed any code to the system in about 3 years if I actually look at my commit history.
But that, like, being obsessed with your business and their characteristics that will have put you up for success so far. So it's a really tough to, like, my business was my first baby before I actually had human babies, and you are obsessed with it, and I'm not advocating for the kind of grind lifestyle of no balance at all. But if you're not obsessed with what you're building, the solution it is, the solution it's providing for your users, then something will go wrong as well. And so there has to be passion in it.
The thing is, something will go wrong. And like, regardless, it could be any aspect of the business. So, I mean, like yourself, I'm sure with any business, there are a lot of very, very tough days. And you have to be able to pick yourself up after getting knocked down time and time again. And I mean, if I was working on any other sector, if I was in, I don't know, fintech or mobility, like I could not have seen myself pushing through the business. But the thing is, what's really great about this industry in health and sports is the founders do tend to be very mission driven. I mean, like, yes, we would love to, be successful and make lots of money and returns to our shareholders. But, I am going to fly the mission focused founder flag, which is we're building this business to try to make movement health more accessible. So helping physios scale up, allow greater access to coaching, whether that's physiotherapy or elite sports training to help them be more effective, or the everyday person trying to get involved more in the gym. So any of the hard days, it's like, right, why am I doing this? Where could we bring this business? And just keep the head up, looking at that and say, right, how do I just jump over this big hurdle that's been put in my way today?
Yeah. So there's a couple of things I want to pull from that. But firstly, it was a conversation I actually was having with the CEO of Orico actually yesterday, which was around patient capital in this space. Um, and that aligns to, like, you may be building software, but who you're building the software for and the problems that it's solving isn't the same as a B2B SaaS offering that Silicon Valley and VC funds are used to funding in the software space. It's not, you're talking about human behavior, you're talking about athletic performance, you're talking about longer longer cycles, I suppose, of selling as well as building trust. So yeah, it's quite a different mindset that investors have to be on that journey with you, and I'm sure there have been some conversations that you have had over the last 4 or 5 years that don't understand that or don't align to that, and that's fine. But you do want the ones that do understand that.
I would totally agree, Nicola. I mean, it is extremely challenging. I know every founder will say, oh, I have it particularly tough. But the thing is, like, while we could tick a box B2B SaaS, oh, we sell business to business, we are software as a service. But a VC fund, like, especially now in AI, like the growth uh, metrics they want to hit are even more aggressive. It's like, oh, well, you launched last year. How come you don't have 100 customers yet? How come it's taken you 6 months to get this contract over the line? And, I have to try to explain, well, look, these are longer sales cycles. We're doing, early adopter rates. We're trying to get adoption, case studies, validate the tech. And I would honestly say it's probably 80% or more of conversations, whether that's with investors or people who are very, good natured in the startup ecosystem, saying, no, that's too slow. That's not going to float the venture capital model. But like that thing around patient capital, like it's great because it's covering two words, right? But the patience piece of, well, look, we want to build the infrastructure to help human movement health scale. That's not going to happen overnight. And if I try to think about it as a spectrum, where you have your typical B2B SaaS or AI startups now, where they can build a product today, if they find the right market, they could try to scale that to $100 million in revenue within a year. And then you have the other end of the spectrum, which is your hardcore medtech devices. So, your class 3 FDA, where it's getting implanted into the human body. There are years and years of build up with animal tests, all kinds of clinical trials, FDA regulation. And so we are absolutely on that spectrum. And so that's certainly been a challenge of mine, is getting that story across to investors that, yes, we are a software product, which does mean we can iterate a lot more quickly, at least on the product side, not necessarily on the proving out the case studies
Mm.
and the validation. But it's that kind of weird gray area where medtech investors will sometimes say, oh, well, we just focus on life sciences.
Yeah.
And then SaaS investors saying, oh, well, your growth rate is too slow and your contract sizes are too small today for what we typically like. So that's just a flavor of some of the challenges I faced
Yeah.
while trying to raise this seed fund, this seed round.
But it also, I suppose, it iterates even further the importance of an ecosystem that does support it, like Enterprise Island has provided. And obviously, the more that they back health and sports tech and human performance companies, they'll understand that it is different as well. We've skirted around, I suppose, a few bits about what your company is and what it does. But historically, obviously, motion capture is sat in labs. It's required in massive budgets, but you're delivering 3D biomechanics through a phone camera or an iPad. Technically, and I am kind of non-technical when it comes to this, so please keep it, I suppose, high level. What does that mean, and how has that advanced how you can deliver motion analysis for people?
Oh, well, I sat in full time on the business 4 years, but this has been a problem I've been sitting on for more than 8 years now. So it was during my final year of my computer science studies in university where I was thinking about, projects for my final year thesis. But it really came to me in the gym one day because my background, my passion is in competitive Olympic weightlifting at a regional level. And also I'm a qualified personal trainer at an entry level. So I could manage gym desk should I need to, but far from the clinical level you would typically require for this type of business. But that aside, when I was thinking, right, I can see my form in the mirror, and when it's imperfect, I know how to fix that based on my basic understanding of biomechanics, but I know most people don't. They're either taking videos sent to their coach, or they're losing motivation in their exercises, or worst case, injuring themselves. And I thought, right, well, how could technology help with this particular issue? And so as I was digging into it, I was playing with the Microsoft Kinect camera that I had for my Xbox, which comes with its own software kit. So you can plug that into your laptop, and it comes with a code tool. It's called a software development kit. So an SDK that Microsoft allow you to play with the data. So I was able to see, oh, I can capture a person here. That's where they're moving. But on the Kinect, it was great for building a proof of concept. I was able to show, look, this is the hard coded model that I've built up for individualized real time exercise analysis. And so that was the original thesis, let's say. And my professors were saying, this could be an amazing startup. Why don't you do this as a startup? And I said, well, I would love to, but I don't think the hardware is there. And I also want to get some real world tech experience. I want to save some money, and I want to live life a little because I've been working my ass off in university, and I know that running a startup is not going to be easy. So I will bide my time. And so when I was working in big tech, this was like my weekend side hustle. So Intel released a way better 3D camera than what Microsoft had, which was their RealSense cameras, which are used very commonly now in robotics. And so this was better for helping build out a more fleshed out proof of concept. But I just thought the form factor wasn't there. Having to use a 3D camera, plug it into a laptop, and the laptop had to be a very high spec because all the data processing has to be done to detect that person in 3D. So it was then that I saw Apple were launching their iPhone and iPad Pro devices with LiDAR built in. So LiDAR, LIDAR, means light detection and ranging. So this sensor is very commonly used in self-driving cars. They're often used for surveying landscapes. And so this means that it sends out a huge array of lasers from the phone. So it means it builds up a 3D image of the room. So we combine that with the camera data and machine learning to pick out 33 points of the body to a super high degree of accuracy in real time just on your phone. And it can run even offline. And so with that data capture we have our own proprietary algorithms in the cloud then that pull out key metrics like range of motion, speed, imbalances, and build up a completely individualized model of your athlete or patient. So you can be tracking, like their force imbalance when landing, or their range of motion for their ankle dorsiflexion, how that has progressed over time. So it's really trying to bring the data quality and quantity of the motion capture lab, but into your phone in real time. And it really is that technology from Apple that has made that possible in the last few years, along with AI and machine learning. But I would have some, like, not always positive opinions about AI as well.
Well, AI is thrown around obviously day to day now, not just in tech businesses. What is, I suppose, the actual machine learning that's happening in your technology, in your business? And how do you then validate that? And what does it mean to, I suppose, the end user or the athlete?
Yeah, there are two key aspects there. So the first one is the joint capture on the device. So we're using machine learning to combine that 3D scan of the room with the camera to pick out those key joints. And so how we then go about validating that is through our studies on goniometry, validity testing, and motion capture lab validity testing. So for the motion capture lab, we would set up our iPads at different angles in the mocap lab. The subject would be set up as normal with all their markers stripped down, super laborious and manual, as you know. And so the researchers then would capture the mocap data. We would do the capture on the iPad, or the researcher would on our behalf with the iPad, and then essentially do a cross comparison of, right, what was the range of motion calculation for the mocap lab versus the device? What was the mean concentric velocity? And picking out the individual markers and seeing, well, do they align? Are they accurate? Because that's the most fundamental piece. If the baseline data you're getting in is not accurate, anything you build from that, no matter how much AI, is not going to be good.
Yeah.
Rubbish in, rubbish out.
Yeah.
We tend to call it in machine learning. So
Or
that's the
even
first
ruder
aspect.
sometimes, beginning with S.
Yeah, a bit more polite for the podcast, but yeah, that's only the first aspect. But what we're really building out is an AI model for completely individualized real-time exercise analysis. So the data set we're building up has all the key body markers and your typical movement patterns. And so we're building out this data set to essentially help to coach you remotely without your practitioner there right beside you. And so that's going to take a huge amount of more data along with clinical validation to say, right, we can actually deliver this product. But anything, if we're using AI to say, well, okay, based on your movement patterns today, this is where we see an anomaly on your movement that we need to notify your practitioner about. So to be able to prove that out, we have to go through a lot of studies, build out the product, and that's going to take patience.
Yeah, definitely. And you're positioning that really as like and I think I've either read it or we've spoken about it before, like an intelligence layer. So it's more than the software. There's a whole platform there that then allows the user in the future. And I think that's the bit people don't always, I suppose, understand or give credit for, is that's a long-term play. That's a moat that you're building with that data set. But it definitely doesn't happen overnight.
Oh, for sure. And like that's one of the questions that investors will ask. Well, what's your protective moat there? And I suppose that line on the infrastructure, the platform, like we don't necessarily see this as a specific product or app just for the end user. We like to see our infrastructure as something that other companies could leverage. So if there are companies that are specifically focused on scheduling for clinicians or on exercise prescription or just on program feedback, they're the kind of systems that we could integrate with and allow them to enhance their services. So these are all just some ideas that we're really fleshing out, which of course is an interesting balance you have to make between what do I need to get done today and then how
Yeah.
do I accomplish in the next 6 months, but also tee that up with, right, what do you want to achieve in 3 years' time and how does that all fit together?
Yeah, well, yeah, discussions I have on regular basis from with my strategy kind of hat on, of prioritization, long-term vision, limited resources, be that time, people, money. Like, where do you position yourself now compared to in the future? What does that North Star look like there? And quite often, I think like startups either maybe don't give time to strategy, or it's hard when it's a constantly evolving, like it's an uncertain environment. You haven't got the historical data of a long established business, and you haven't always got even the product market fit, or the like a lot of the decisions can be either made on n=1 because, oh, I spoke to one customer and this is what they said. And so it's a real balance, that but that's also what I think makes strategy in startups really, really real, is that it's not just a document that you write and you don't look at for a year and it goes put in the top drawer, which can happen in larger organizations. It's actually really dynamic, lived, breathed, evolving as the product evolves as well. And I assume, like, the customers that you're then talking to, the events that all adds to the picture of what's developing for you.
I mean, like that can change week to week. I mean, what's been very interesting for us is one of the markets we've been getting the most traction in is one that we never even thought about when we were designing our product. And that's for scouting in baseball, because we designed this for physiotherapists, for S&C coaches to get accurate movement data on their athletes super quickly and easily. Whereas we've had scouts approach us saying, look, we don't want to bring hardware on the road. We want to be able to build up a huge data set of all these athletes that we're scouting. And so there are things that's like, okay, right. We now need to think about how we position ourselves for scouting. What are the benefits that these customers are seeing? And how can we make sure that that's projected out to the world? And so there's challenges there. It's like, okay, well, we're getting traction in this market. Do we divert all our focus there? We also have universities interested in the product. We have everyday clinicians interested in the product. So it's, how do we balance the various pull from different segments, as well as marrying that to what are the resources that we have available?
Yeah, definitely. The y- the democratization, which is always thrown about, and I know people hate this because it's what tech really does do, but it's not a nice way of describing it, I think, sometimes. Um, if that happens from a biomechanics point of view at scale, what does that mean, do you feel, for either sport or health? Is there an impact that you see it delivering?
Oh, I mean, well, look, I see this as a really fundamental item that technology just hasn't been able to solve yet at mass scale. I mean, you see everywhere people using Whoop, Aura, all these really high-end biomarkers, but movement quality is still a biomarker that's largely missing. And as you know yourself as a physio, there is so much we can learn just by seeing how someone is moving. And that's not just for elite sports where we're focusing on building our product right now. This is anyone from an elderly person recovering from hip surgery that just wants to be able to get off a chair, to a 16-year-old who's going to the gym for the first time, or someone like myself who's weekend warrior, super competitive athlete. How can I improve my own health and performance? People are using heart rate trackers, sleep trackers to improve their lives in their own ways. And we really believe that motion capture has that opportunity to make a huge impact on people's lives. Because regardless of who you are or where you are, everybody needs to move. You know, whether you're healthy or you have an ongoing condition, there's always ways that we can use movement to help improve our lives. And that's really the mission that this comes down to.
Yeah, that's fantastic. Eh, uh, Maybe I'm slightly biased because I am a physio by background. I feel like motion, and so I'm thinking of my clinical days. I worked with people day in, day out. Um, a lot of it was done on eye, and my eye is obviously subjective. And then if you compare it to a colleague of mine, we may be equal kind of technical physios, but we will see things differently because you're biased against that. And it was only when we started, like, eh, looking at more objective testing around dynamometers and force decks, that it really, I suppose, clicked with me. And it sounds silly now when I think about it, that I was probably like 10 years down the line of being a physio, that it was like, it's not, we think it's objective because you can put a number to it or a word to it. It's not really objective. So what you're not measuring doesn't really get managed and improved in the way that you expect. And I still think that's uh, it may be different at a pro sport level, but when you come down to the general health, um, I do think practitioners still think that what they're doing is objective, even though when it's pretty subjective. I don't know if you've come across conversations like that when you're actually talking to practitioners, and the adoption then of this tech, it doesn't become a barrier, but it's a challenge to the way that they're working.
That's the thing, like if a clinician is honing their own eye over 10 plus years, it is going to be an expert level that is way beyond the general population. But where we try to marry that and where we have seen barriers in the past is around that ease of deployment of objective measurements into the clinic, because you don't have the luxury to spend 5 minutes setting up some testing station. You want to assess the patient, work with them to see how can we improve you this week. And you're very busy. You have to get on to the next appointment. You have admin to do. So, how we've tried to really optimize our system is that it's as simple as recording a video on your phone. And then on our dashboard, we show the video in line with the graphs and the data. So the physio can say, well, I saw that your right knee was caving in. And then the graph follows along the video and shows, oh, yeah, there was a 10% asymmetry there. So it's actually been really powerful in helping patient engagement and buy-in,
Yeah.
because they have a better trust in the physio. Not that they didn't before, but when they can see, oh yeah, this is what the data says, along with what my physio saw with their eye, it is quite a powerful outcome.
Yeah. And I think that is the key of when I was, as say, involved in clinical practice, it was that engagement piece. So it'd be like, oh, well, my pain's better. And it's like, but you're not moving any better, or your strength, there's still an asymmetry or a deficit there. And so like humans are inherently lazy. Like we will take the easiest way to, and so if we feel like 90% of the work's done, we may stop there. But I also very much advocate to that an injury is a point in time where you can come back stronger, because unless it was 100% traumatic, that's something that's built up over a period of time. And so it does need addressing. Um, Going back slightly on the kind of the leadership perspective, like sport, and that's where you are at this point with the aim to move into health, if that's fair to say. It's a man's world. It's predominantly and has been from a leadership as well as kind of a technical perspective. As a female leader in this space, what does it look like for you kind of going forward? And maybe what has changed as you've been on this journey as well? Because we know that from I suppose, a female athlete participation, there's a big drive. But do you see that following into leadership and product development as well?
Well, I would certainly hope so. And I mean, this general environment of, maybe being the one female in the room out of 10 people is something that's not unusual to me, having come from a computer science and software background. I mean, it is really pertinent to note that only about 2% of venture capital every year goes to female led businesses. So it is a challenge that we face ongoing. So we have seen, like personally, I've seen really great supports and funds that are being launched that are specifically for female founders, because unfortunately we do get overlooked. I mean, like my nature, I'm a woman. I'm also Irish, so carrying that Catholic guilt burden, naturally an introvert. So I probably don't come across particularly strong in pitches, because I'm often underselling myself in the product and maybe apologizing when I really shouldn't be. Whereas a counterpart who's male or particularly American, let's say, they could sell the world and get that investment over the line. So that is definitely a strong challenge that continues to face female founders. So my knowing is I need to get out of my own way and to make sure that I'm not apologizing for building out this product. And oh yeah, I'm sorry we've only made X in sales last year, but we did get some great clients, I promise. But the thing is, we need female leaders to be out there, to be projecting. So I mean, there was one woman who came to visit my secondary school to promote biomedical engineering and computer science. And then in my computer science course, there were 70 people, 8 women, 4 of them were from my school. So that can show, if you can see it, you can have that level of influence, even if it's something small. So I would, always, recommend to female leaders out there, if there is an opportunity to visit a school or to host a hackathon, if you're judging a local competition, or, there's so many ways that you can put yourself out there in front of younger women and really inspire them. Because, like, unfortunately, like, I'm not particularly old, like, I'm still in my 20s. In my secondary school, the career guidance teacher said to us, oh yeah, you can do nursing, you can do teaching, these are the best paths. There was nothing we were open to about sports science or engineering, or any of these STEM fields. It was just completely overlooked for women, which I thought was pretty shameful. But I do like to think, with all these initiatives that have come out with, women who code, and like for us, we have a female angel investor syndicate that has been fundamental in getting us to where we are. So women have to look out for women, but you know, that's kind of the experience that I've had so far. But I would say I am still completely privileged and blessed, because there are a lot worse things happening in many other parts of the world. So just because it's taken us an extra, whatever amount of investor meetings to get a deal over the line, I'll take that over some things that are happening elsewhere.
Yeah, yeah, I resonate with what you're saying there. I think that there's a few that I agree around the 2% funding, and I don't think it seems to be a statistic that I've heard. I want to say 3 years in a row, if not more. Like, as in, it doesn't seem to be shifting or changing either.
I
Um,
think I went
I
to 2.5%
yeah,
instead of 2.2.
woohoo!
Okay,
Yeah,
yeah.
and I always remember that stat of, like, if there was a job advert, women won't apply for it unless they meet 100% of the criteria. Men will apply if there's only like 60% of the criteria that they meet. Um, and so it alludes to what we talked around from a strategy point of view in startups, but you just have to go. Just have to do it. Like, um, you can't just keep procrastinating and thinking, oh, maybe I'll do it or someone else will do it. You just have to start sometimes and then see where it goes after that.
And don't apologize for it.
Yeah. That's a hard one. I think that's somehow default hardwired into all of us to either
Yeah.
people please or to not be proud of the I was in a performance review the other week, and someone was like, how's your year been? And I straight away defaulted to all the things that I feel like I didn't achieve rather than the things that I did achieve. So yeah, that's an ongoing, I think, for a lot of people. As you alluded to, you are in your 20s, you're under 30. It's a company that's winning global recognition. You're in rooms and with teams that maybe you did expect to be in, or maybe didn't. But what's the thing that kind of keeps you up at night that we don't hear about or we don't see? Because as we also talked about, startup life is hard.
I mean, it's all about that resource balance and that speed versus management. Because, I mean, I had someone in the startup ecosystem say to me, oh, well, I would much prefer, if I was a VC fund, if you just went hell for leather in 3 months, and then that could decide the make or break, rather than being really capital efficient with your money and dragging it out. But again, this was someone who wasn't particularly knowledgeable about the clinical sector, who was more on that B2B SaaS side. So, I mean, yes, resources definitely has to be the top number one, because we have a fantastic team now, 8 full-time, 5 part-time, but that's across engineering for AI, for the app, for the website, for the database. We have marketing, we have design, we have sales, we have our commercial function, finance. So trying to balance all of that along with, right, is the product hitting the mark today that our customers are going to love? it's those kind of things that keep me up at night, that, oh, what if one bug leaks out? And it means that one practitioner in a complete high-end organization that we're trying to sell to, if that's like lags on one recording, that could be make or break for that key deal, which could be the make or break for a key investor. So it's that domino effect. It's a lot of pressure on your shoulders, but look, I have to come back to why I started the business. Obviously, there's the mission piece, but coming from a sporting background, like, you cannot overstate the importance of looking after your physical and mental health. Because I know that if I wasn't getting my, 7 hours sleep a night and going to the gym 6 days a week, I would almost certainly have broken by now. So, to any founders or anyone in a high performance role, like, please look after yourself.
I have got a conversation happening with a sports psychologist soon, which is around burnout and resilience as a founder. So, yeah, that kind of that grit, that just keep going at all cost. It's not sustainable, and maybe when people are talking like that, they know it's not sustainable, but that's the world that they're either living in. Like, as you said there, if it was just 3 months runway, well, what happens at the end of that 3 months? Like, what happens to the customers that are using that product already? So yeah, health and performance, it's quite a different beast that not everyone understands. But also, you want to be in it for the long run. And the majority of companies, it's more that they've stuck around long enough to learn as well. Sometimes it's not always the best product initially, but you've got enough time and runway to make it the best product. And that means you just have to be in the game and not out of it because things have gone too quickly.
And you certainly have to look at Arco as a key example there. I mean, they're
15
from the
years.
same city as I am in Galway. Like, I think, what, they're 15 years on the go now. And now they have Mark Cuban, a world known investor, backing them. They're in many of the top teams around the world. They have an incredible product, but it was not built overnight. They have teams of PhDs, statisticians, all these validation papers published. And so, like, I do hope we could follow in their footsteps and be a shining beacon for the West of Ireland sports and health tech.
Well, you're definitely on that path. So, yeah, amazing. Emma, thank you so much for the conversation. Great to understand where you're coming from, but also to know more about your company as well. Where can people find you if they want to talk to you, but also find out more about your product?
Yes, if you want to see about our product or to get in touch with our team to give it a go, our website is kinetikiq.com with two Ks. So KINETIKIQ. We're on Instagram, we're on LinkedIn, we're on YouTube. And then if you want to reach out to me personally, you can get me on LinkedIn, Emma Meehan.
Lovely. Thank you so much, Emma. Great to speak to you.